And Dr. Geskin joins us from Columbia in New York City. Some of you, I think, are her patients and know her well. We have been partnered with Dr. Geskin for a very long time. She is one of the experts, global experts in the field of cutaneous lymphomas, and has a wealth of knowledge and experience. And today she is joining us to share skincare tips and sharing her experience around managing your skin. And we're going to get her. There she is. Good morning. It's so nice to see you.
Good morning. Good morning.
As
nice
always.
To see
and thank you
everyone.
for joining us. I'm going to turn it over to Dr. Geskin, and she's going to take it from here.
Thank you. Nice to see everyone. I see some familiar faces. It's good to see all of you. It's my pleasure to be here, and thank you all for sharing your stories. I am a big patients advocate, and we have sometimes very tough conversations, but they are necessary, and whatever we need to do, we need to do. So I just want to tell you, for those of you who don't know me, I'm a director of Skin Cancer Center at Columbia University. We have a center where we see the patients from the Midtown Manhattan, where you can see, I'm just going to take a pointer, and I will point because I cannot speak without my hands. So you will see that we have a Midtown office right across the street from Rockefeller Center, from Radio City Music Hall to the Washington Heights up north in Manhattan to Tarrytown, beautiful Tarrytown in Westchester County. I have very popular place, free parking. So I can tell you, you cannot get appointment there practically for 6 months. So, yeah, we have many specialists that are specifically focusing on skin cancer care, and cutaneous lymphoma takes a bulk of those people who take care of patients that come through Columbia University. I'm not going to dwell on all the services that we provide, but we have a full lymphoma service that ranges from very basic psychological care, dietitians, radiation oncologists, psychologists, of course, dermatologists, derm-onc, and so on and so forth. But let's talk about skin. Let's move on. And the purpose, my purpose today is to tell you a little bit about skin care. And so I will focus on that right now. So a little bit of an anatomy. I know you're all experts now on skin anatomy because I'm sure it's been talked over and over before, but I just want to make sure that we're on the same page. And so the skin has several layers. It's quite a complex structure. People don't appreciate how complex the skin is. On top of it, there is a layer called epidermis, and on top of epidermis, there is a stratum corneum. Stratum corneum means the cornified layer, and this is a very important layer that I will be mentioning, so I want you to just remember that word, stratum corneum. And under the epidermis, there is a dermis, and it correlates, this top layer correlates to that darker layer on top of this actual histological slide. This is a dermal layer, and this is subdermis. And as you can see, in this actual slide, there are lots of blue cells that don't belong there. Those are abnormal cells that we see on biopsies. When we do actual biopsy, this is what we see on the pathology. And so that is what is causing dryness, scaliness, redness, itching, discomfort. Those cells that don't belong, they create inflammation, they create shedding, they create all the symptoms. And so what does it translate to? It translates to red patches and plaques on the skin. So when you see this, it creates inflammation, it creates bumps on the skin, raised skin, scaly skin, and in addition to that, it creates immunosuppression. So in addition to it, it really damages the skin layer as our protectant, and it really causes all kinds of damages to us as a whole, and I will focus on that. So this is probably the simplest and the most important slide of the day. Why? because quality of life is utmost importance. So whatever therapy we choose, we have to focus on comfort to patients. We have to choose on what's best for the patient. And so there is always this yin-yang. We have to have some therapies and we have to have some questions about quality of life, and they have to be balanced. And this is very, very important. We have to prepare for the marathon, not a sprint. When patients come, I always try to at least tell them about what's there for them in the future, set the expectations. I don't want people to think that I have a magic wand and I can just wave my hands and miracle will happen. Sometimes they happen, most of the time they don't. We have to prepare. And so one of the most important things of the day that I do when I see my patients, and my patients can attest to it, I'm really big on skincare. If I see 40 patients a day, I repeat it 40 times. It's so important. And so here we will just have a little introduction. I will tell you about my approach to skincare and what can we do to do good skincare in the future. I will talk about skin pH, the acidity of the skin. It's so important. It's been ignored on and on again. Lipids, lipid barriers, microbiome. We are not living alone. We have guests, and sometimes they are welcome guests, and sometimes they are not such welcome guests. So we need to make sure that we treat our good guests well. So we'll talk about that. And I want to talk about overall illness and relationships of skin and chronic illness and time. None of us can avoid time. We also have to think about that. So what can we learn from other skin diseases? So I will show you some evidence and talk about just basic rules of skincare. So what is the skin? Why do we have skin? Why do we need to worry about skin? Well, actually, skin is the largest organ in our body, and it's a very important organ. Not only it protects us from outside, from the hostile environment that comes to us, it keeps us warm or cool. It helps us sweat and balance our fluid balance and does 100 other things. So it's very important to keep our skin healthy. But what does chronic illness do to skin? It actually damages the skin in many different ways, and I'll touch upon it. But what's important, we have to be holistic about this. What does it mean? Not only chronic illness damages the skin illness makes us sick. So there is also a balance that we need to do, we need to observe. So what are the basics of skincare? Again, I will repeat it just very briefly. There are several layers to the skin: epidermis, dermis, and subcutaneous layer. We talked about barrier function, and we talked about stratum corneum, but it's very crucial layer that protects us, and it is the layer that keeps our skin hydrated. So I will focus on that a little bit more. I will start with something that is frequently ignored. Very few physicians focus on this, and I think it's because we're focusing on what's important, on your disease. But I think we need to think about skin health in general as well. So I really am very big on skin pH and keeping skin acidity in a way that is the most healthiest for us. And this the schematic representation shows you that normal skin pH is actually acidic. It's about 5.5 plus minus. And it influences how healthy our skin is. It influences how our friends, our microbes that are good microbes, how are they surviving on our skin. it can make skin hostile to bad microbes. It can actually make them go away. And it's important to keep it at that level. What does play a role in keeping skin acidity? Your diet, your hygiene, environment, and many other things that we'll touch upon. So what do we do to facilitate that optimal microbiome? And microbiome, it means that we live in a world of microbes that are good microbes. We have to have them. They help us to keep our skin healthy. They are fighting against bad guys. And so it's very important to keep our skin with a healthy microbiome. So it's very important for us to have balanced pH. And with that, we have long-term benefits of that acidic pH. So is there science behind this? Yes, there is a lot of science. I'm not going to show a lot of scientific materials, but this is very interesting at a glance. You can see this is a normal skin, and on top you can see there's a lot of orange there. This is eczema skin. This eczema skin has a lot of all kind of enzymes, proteins that destroy the cells, destroy the microbiomes. And what I created, and I call it the Geskin regimen. My regimen, because I have a step-by-step instructions on how to preserve that acidity to the skin. And every patient who comes into my office gets this yellow handout that has instructions on how to bathe, what to put in the water, for how long to stay in the water, how to dry your skin, what to put on your skin, and how to preserve that process. I will discuss it a little bit in more details shortly, but I just want to show you that this regimen is based on very solid science, and it's really something that is nice for your skin. So moving to next, very important ingredient for our skin health is lipids. And as you know, when you put something thick thick layer of grease on your skin, it repels water. It doesn't let the water penetrate. How can it be good? So let's think about it and let's talk about this. So lipids on the skin are very important, and there are many different types of lipids. The lipids that you and I make, normal lipids, are called ceramides. And so you will see some of the pharmaceutical companies making these creams and ointments that have cera in them because they contain those ceramides, those essential moisturizers that you and I make. There is also fatty acids and cholesterol. So one of the most important things I have to say, pretty much all my patients are on cholesterol-lowering medications. There is a lot of benefit in taking cholesterol-lowering medications, and I'm all for it. But you have to understand, once you lower the cholesterol, it lowers your skin cholesterol too, and it results in breakdown of the skin. So it's not infrequently that I see people who go on high doses, especially on anti-cholesterol medications, have dry skin. So we have to consider that. And so lipids are important to prevent our water loss to outside, and we will talk about this in a second. But I just want to touch upon a third ingredient of our skin is called microbiome. And this is something that is also quite important. So microbiome is important in skin health. And in this little cartoon at the bottom, you can see healthy skin that has a healthy microbiome. It has a normal pH. It's called acid mantle. We have a mantle on top of our skin. And it has a normal lipid barrier. So not only it preserves the water, it has this normal environment for the normal microbes to live on our skin and reject all kind of hostile environments. In unhealthy skin, usually all three of these ingredients are broken. Now I will just quickly touch upon time. Time, we don't have time machine, but there is a little bit we can do to fight the time. And so I will, again, speak a little bit about what we can do to keep our skin healthy, even in face of aging. And so we can certainly do certain things to build healthy skin, collagen, and such. And so, again, another big thing that kind of goes into the whole picture is environmental and lifestyle impacts. Pollution, oxidative stress, cosmetics that people put on themselves, lifestyle factors, stress. So I just separated stress among all of these many, many factors that are quite important for skin health. Don't throw stones at me, but I have to tell you, every time my patients have stress, and it can be physical stress, it can be emotional stress, their disease flares. I observed it over and over again that when they come to me and they go through stressful life conditions or physical stress that they shouldn't have over exercising, their skin can flare. And I see it over and over again. So I think it's very important to incorporate into your daily routine things like meditation, stress reduction, and things of that nature. So what can we learn from other diseases? Because look, this is a picture that shows how similar CTCL is and psoriasis and eczema. They actually have a lot of similarities, so what can we learn from them? So they're very similar in a sense that they create inflammation in the skin, and we have to fight inflammation. We have to moisturize, we have to use topical steroids. In CTCL, we also have some other topicals. This is not today's topic, but I will touch upon it just very briefly at the end of my talk. And you have to consider the role of environment and see what else is affecting you. Besides CTCL, some of my patients have eczema in addition to CTCL. You're normal people, you can have normal diseases. CTCL is rare, but atopic dermatitis is not, psoriasis is not, fungal infection is not. So you may have other things affecting your skin. You have to think about that. And so what do we do? How do we start our day? How do we start our routines? And there are very simple ways to do it. You have to create a routine. And some of them are gentle cleansers containing very nice lipid-containing cleansers with balanced pH. Then moving on to moisturization that would allow for that skin hydration and repair the barrier. And so some examples can be, I mentioned ceramides. So CeraVe, for example, has ceramides. Vanicream is a hypoallergenic brand. There are some other brands. I'm not endorsing any particular brand. You really need to look at the ingredients and see what is there. Look at those balanced ingredients. Moisturizing after cleansing is very important. What type of moisturizers are there? There are occlusives and all kinds of humectants and emollients. I'll kind of jump to this. So humectant is the type of a moisturizer that attracts the water from the environment and from your skin. Some of them may be actually even drying because they kind of attract the water from your skin to the top of your skin, so they may not be balanced as well as some other ones. There are some occlusives, and those are the thicker ones, the kind of Vaseline-like, like thicker ones that don't allow the environment to take water away from you. And there are some emollients that soften the skin. And so this slide, Grease for Peace, was made, I don't really know how many years ago, probably like 30 years ago. I just love it, and I keep it, and I always show it. But this slide shows the water content decreases from ointments to creams to lotions I'm sorry, the other way, the water content increases, the water repellent capacity decreases. So ointments are the most moisturizing. So if your skin is dry, don't buy lotion. I know it feels good, but it's actually drying. Buy ointment. And those are the ones that preserve water. Now, we mentioned ceramides, fatty acids, but what's also important is a combination of things. So when you actually look at the ingredients, look for all of them being there and combination of them. So we're going to look at some case study. This is a patient with CTCL. How do you know it's CTCL? You see this Mickey Mouse sign. I'm just kidding. But it's actually, you can see those, abnormal red patches. But look, this patient only used moisturizers and very mild topical steroids, and in 2 weeks she was clean. In 2 weeks it went away. Sometimes even without topical steroids. Actually, I forgot I wanted to put one more slide in. I just remembered that I didn't do it. I want to tell you that we are now studying a new moisturizer. It's a liquid dressing, they call it, liquid dressing. What does it do? It creates a nanoparticle layer on top of your skin and preserve that natural water in the skin. By itself, without steroids, it can help to relieve actually even itching. Not, of course, not to the same degree as steroids, but it helps to minimize steroid use on your skin. And so moisturizers are so important. And combination of therapy and skincare is so important. For example, some of the topical creams that we use for treatment of the disease, such as mecloretamine, Valclor, right? It can be quite red, it cause redness and irritation in the skin. Using it together with moisturizers, combining it, and making you tolerate this treatment that you need better is really critical. And so we have to really target it to each individual patient and create that kind of environment of your skin. So gentle cleansing. I just want to make sure that, when you clean your skin, you be very gentle. You don't use alcohol-containing compounds. Again, check ingredients. Use not hot and not cold water, lukewarm water. The same goes for bath. We'll talk about that in a sec. And avoiding harsh products are very important. Daily moisturization, creating routines, post-bathing moisturization, and irritant-free products are important. This is all familiar brands to you, I'm sure. I don't enforce any particular brands, but look for ceramide, glycerin, avoid alcohol, and drink. Drink water, drink a lot of water. It's also very important. When we focus on the skin care, we forget that you actually need to intake some water yourself because you need to have that water coming from somewhere. Another important thing that is being ignored is food care. Some patients with CTCL, some patients actually, with very mild disease may have feet affected, and this is kind of ignored part of our body. Examine your feet, look at your feet, make sure they are taken care of, nails and such. Have a good footwear. Wear comfortable footwear is very important. And in addition to that, I just want to mention again, people may have diabetes, may have other conditions that may affect skin and feet. And that actually doubles the necessity to take care of your feet. And feet can be affected by CTCL, but again, they can be affected by many other diseases, and it may look horrible. It may make skin feel bad, but they are not necessarily CTCL. Look, it may be psoriasis, it may be fungal infection, it may be eczema, it may be anything else. Again, don't ignore the findings that you have on your skin, they may not be CTCL, and they may need some treatment. And so creating that daily care routine is very important. We talked about your morning and night routine. Hydration is very important. Now, balanced diet is very important. Certain products create inflammation in our body, and healthy diet is very important. Again, I'm not telling you anything I think different from what your mother told you, but sorry, this is important. Your mother was right, so I apologize. I know it's a little boring, but it's important. And stress reduction, again, very, very important. And so empower yourself and protect your skin. Practice self-compassion. Self-compassion is important because many of my patients are busy individuals. Some of them have little children. They run around. They don't have time for themselves. And I tell them, you have to take your time for yourself. You have to find 20 minutes a day where you say to somebody, give me 20 minutes. I will take care of my children in 20 minutes, of my family, of my loved ones. This is 20 minutes of my job. Some people are very busy. You know, they can have very important jobs. 20 minutes to yourself and commit to routine. And so in conclusion, I really seriously want you to love your skin. I think it's very important to take good care of your skin, to maintain your skin, to create that routine that we discussed, to have those ingredients we discussed, to think about other things that may affect you, not necessarily just CTCL. You really have to have a holistic approach to your skin, and you have to think about diet, exercise, and all those good things. And with that, I would like to thank you for your attention. And I don't know if we take questions.
We're going to take a couple questions. I know we've got one from our home audience, so we'll take, because we're live streaming. So, Deb, go ahead.
Thank you so much, Dr. Geskin. Okay. So the question is, might prolonged insufficient pH levels be the cause of cutaneous lymphoma, at least in some cases?
Good question.
This is a very good question. Thank you. So I would say actually nothing can be cause of lymphoma. We don't know, like many people here mentioned already, we don't know why people have this lymphoma. So cause is certainly not an issue, but what can be an issue is worsening of CTCL. Aggravation of that disease may be an issue. And certainly normalization of pH, that Geskin regimen that I mentioned to you before, bathing, what I do and what this handout has, and it's actually published in the literature, and many people use Geskin regimen. So just again, to respond to that pH question, when my patients get this handout, first thing they see is that when you take that bath, you have to add a cup or even 2 cups of white table vinegar. And my patients joke that they're going to make a salad. No, you don't make a salad. You don't smell, you don't taste, because for the whole bathtub, you just take 1 or 2 cups of white table vinegar that changes the pH, but you don't feel it. And you stay in that bath for at least 20 minutes. Guess what? Showers are drying, short bath is drying, long bath, 20 minutes bath. And so that's what changes the pH of the skin. That makes your skin hostile to bed bugs and very welcoming to good microbiome. And so to answer that question, I would say pH does not cause CTCL, but it may cause worsening of CTCL.
Good question. And we are going to have Dr. Geskin with us for the Q&A after we pick up our lunch. So we'll take a question, but if we don't get to it, we'll ask it.
Thank you. I'm so glad to hear you talk about water intake. I drink 80 ounces of water a day. That's the minimum. And if I go several days in a row without meeting that goal, my skin begins to get tight. And I'm like, okay, you haven't been drinking your water, girl. And so I think that's it's low-hanging fruit, but we're not getting that. Our doctors aren't telling us drink water because it helps with hydration. I do a mixture of raw shea butter, coconut oil, organic coconut oil, a couple of tablespoons of black seed oil, and a tablespoon of triamcinolone. I whip that all together, and it's so whippy and creamy, and it just feels so good on the skin. So seeing your regimen, I'm looking that up. I've never done the vinegar, but I'm going to be adding that. Thank you so much.
Oh, you're very welcome. I don't think anyone can repeat that routine, but the goal is at least to use the over-the-counter moisturizers, and certainly drinking a lot is a goal. 8 glasses of water is the kind of overall goal. I don't know how many people can do that either, but at least 3-4 cups of full glass of water a day would be really good, kind of intermediate goal until we get to the top. Yeah, vinegar is very important for those baths, because when I actually was in training, people used to add chlorine to the bath, and they thought that it was cleansing the skin, and it may have this cleansing effect, but also what it does, it creates a biofilm, and biofilms are not good on our skin. Biofilms actually seal the bacteria, and we cannot fight it. And so it's okay to use a little bit of a chlorine bleach in your bath, but you have to alternate it with the vinegar soaks. And so you really need to understand what you are doing, and so your physician can help you. And actually, since I got this assignment to give this lecture, I decided, I went through the literature and I realized there is really not a single comprehensive skincare, kind of not even a manual or description that our patients can use. And so guess what? We're on top of it. We are working on it now. So my fellows actually have a goal, and they are working on that right now. So we're going to go over this. We're going to publish it, and you can have it.
Great. We're going to do one more question from our home audience, and then we're going to grab our lunches and come back for the Q&A.
So the question is, as a caregiver of someone with Sézary syndrome, is there something I should watch for?
Well, this is kind of a broad question. Watch for yourself, or watch for your loved one, or watch for, there are so many things that we can address. I don't even know if we have time for this right now, but certainly allowing your loved one that time to take care of the skin, helping with the care of the skin, helping with areas that are hard to reach. Certainly that's one of those things. If you're applying certain medications, wear gloves. If it is about yourself, and actually this advice that I just gave to all of you is good for everyone. So it's good for caregivers as well, and it's good for all of us to take good care of our skin.
Great. Thank you.